from vaccines on the cause of religious beliefs. As a Catholic, I find it really upsetting to hear that people are using religion when the Catholic Church clearly states that vaccines are not only necessary, but they save lives and they support vaccines. There's many other religions, almost every religion in the world supports vaccination, so I think it's really important for us to keep that in mind. So when you're here today, you're hearing a lot of folks testify, just remember, you know, we're here from Connecticut. I'm here to talk about my family, and I want my kids protected. And one thing that I think is really confusing is that these legislators have a really difficult decision to make. And they may not be hearing from the average parent, which is 98% of us are vaccinating our children on time in this country. But I don't think parents have any idea that even though I have vaccinated my children on time, they're still at risk because these diseases are so incredibly contagious. They look for these little cracks in communities, and that's where they stick. And so we have to remember that even though we vaccinated our children completely, they're not protected unless all of their students and their peers in daycare are also vaccinated. So I thank you for having me today. I hope that we can work on this legislation. I know the legislators have some tough decisions to make. We've gotten a lot of parents to write in, but there's an awful lot of people out there that have no idea that their kids, you know, even though they're vaccinated, may still be at risk. So thank you.
I would next like to invite Dr. Jody Terranova from the American Academy of Pediatrics, the Connecticut chapter.
Thank you. Pediatricians from across Connecticut are standing here today with our legislators to do what we do every day, advocate for children. We know that allowing only medical exemptions for vaccines for children in daycare and school settings is the best way to improve our immunization rates and keep all of our children, including the most vulnerable, safe and healthy. Parents who choose not to immunize their children for other than medical reasons have every right to make that choice. But they do not have the right to include that child in school or daycare where their lack of immunization has the potential to cause harm to other children. We cannot allow fear and misinformation to weaken our children's safety net and once again have to care for children suffering from crippling diseases like measles and polio. The children of Connecticut are depending on the legislature to keep them safe by passing HB 5044. Thank you.
That concludes our speakers for this morning. Do you have any questions?
Yes, so Dr. Nikolai or Dr. Baum or both, can you address some of the stuff that is circulating on social media that people are believing? Because, you know, people don't trust the government, they don't trust the media, and they don't trust the medical profession because they see this stuff online. Can you address that, either one of you or both of you, please?
Yeah, I think we need to be very careful when we look online and social media and talk to our neighbors and our friends. I want to encourage people really to listen to the experts. And there is a definition of an expert. And an expert is somebody who, what they talk about is what they do for a living. So for example, our Connecticut Department of Public Health, state epidemiologists and people working, they're experts because they do that. I'm a scientist, so I'm an expert in research, and I can vouch that vaccines are safe because I'm a scientist, I'm a researcher, I can read the literature and know that it's safe. So you're going to hear people today talking, and you'll see things on social media. I think it's really important to look at the source, and we need to listen to the experts, people who are professionally trained in what they do, because they are the ones who can share the correct information. Does that answer your question?
Yeah, and were you the one that said it looks like about 14,000 are not
So,
inoculated? Was that you or Dr.
That
Baum?
was me.
Okay.
So that number, I'll tell you where it came from. We currently have 2.5% of kids who are receiving religious exemptions from school entry requirements. We have over 500,000 kids in school, about 550,000 kids in school. So I just multiply that. So because that number, that 2.5%, applies to kids entering kindergarten, but they enter kindergarten and then they progress through the school system and remain unimmunized.
So in a herd, to use the medical term, of over 500,000 people, how dangerous is 14,000?
Very. It takes one. It takes one kid to get measles. They can get it from travelers or from traveling. We saw this last year with measles. An infection gets introduced. It takes one kid to get sick, who then makes 3 kids sick, who then makes 10 kids sick. The word crack was used earlier, and it's a great analogy. It doesn't take a lot of kids to be unimmunized for epidemics to take hold and spread.
Well, now, a lot of these folks will say it's better for them to get it because they get immunization naturally. I had measles when I was a kid. I grew up in the 50s. Almost everybody had it. I'm told by Dr. Carter, the epidemiologist, that I have lifetime safety. What's wrong with that philosophy?
Well, to use another word one of my colleagues used is that's a gamble. So you're lucky. You got measles, you recovered. Lots of kids get measles or other flu, for example, and don't recover. So that's a gamble. And is that a gamble you're willing to take? It's a life and death question. People die from infectious diseases. They don't die from the vaccines.
But Dr. Baum mentioned the 1918 liar.
Don't do that in here. Liar.
This is a news conference, please. We're earning a living doing our job. You mentioned the 1918 flu epidemic. There still is no vaccine for that, from what I have read from reliable sources.
Not true.
It's not true?
In 1918, it was the H1N1 influenza A. That's been confirmed. We do have a vaccine. This year's tetravalent vaccine covers 2 A strains and 2 B strains. And one of those A strains is H1N1. And I would agree that when you got measles, you survived because you were lucky. Maybe you were healthy, but you survived mainly because you were lucky. A lot of people probably did not survive that same wave of infection.
Can I discuss that real quickly?
In 1989 and 1991, there was an outbreak of measles that caused over 50,000 cases in this country, and over 150 people died. Many of them were children. That's when former First Lady Rosa Carter and Betty Bumpers created Every Child by Two, because they didn't want to see another child die. We're seeing more cases of measles in the last 2 years than we have seen in several decades. We eliminated it from this country 20 years ago, and here we are, dealing with measles all over again. And so it is an incredibly dangerous disease. It wipes out your immune system, first of all, so that you can't fight off other diseases. And 8 years after you get measles, children can suffer from another form of illness that can kill them.
And we had one case, there were several in New York, near us.
I'll let the experts from Connecticut discuss the cases here.
Yeah, who can remember what happened last year? Thank you.
Hi, my name's Selena Bell. I'm the director of Connecticut Citizens for Science. I'm just going to urge you to read Ronald Dahl's letter when his daughter died of measles. It's very, very touching.
I'd like somebody to answer my question so that we know.
19, it was either 16 or 19 people in New York ended up in the ICU
Right.
for measles. 654 people got the measles. Approximately 54 ended up in the hospital, and it was 16 or 19 people. Most of them children ended up in the ICU
Right, but there was
with
only
tubes
one, there was
and
only
needles.
one here. Isn't that right?
Stuck in their arms from the measles, a preventable disease. Let that sink in.
So, yeah. So last year with the measles epidemic, Connecticut had a relatively small number of cases, and I'm going to reiterate the point I made before, which is we got lucky. Just like you got lucky, Connecticut got lucky. We had measles all around us in New York. Part of it was luck, but part of it was also the very committed, thoughtful reaction of our Connecticut Department of Public Health, again, leaving it to the experts. So this combination of our health department being poised and ready and a little bit of luck, we were largely spared. We're not going to be so lucky next time, right? It's not a question of if it's going to happen, it's a question of when it's going to happen, that an entirely preventable, deadly infectious disease enters our state. It's not a question of if, it's a question of when. And the question for our legislators and our constituents is, are we going to be ready when it happens by having all of our kids properly immunized?
Perhaps Representative Steinberg and Senator Abrams could speak to this question. We really don't know where this legislature stands, or Senator Anwar as well. Anybody else want to get in there? We really don't know where this legislature stands on this issue. There's really been no vote. This came up last year after your committee. There was no bill raised. What's your sense of where things stand? I mean, we're not even sure as we stand here today that after this hearing that you will have the votes to get a bill out of this committee.
This is the process. This has always been the process.
I understand that. I'm just asking what
we craft the best bill we can. We caucus with our committee members. We do the best we can to sift through all the information that's presented. And then we take a vote in committee. I'm pretty confident we're going to get this out of committee. And we will also be having to check with legislators should it reach the floor. This is the process. We would not be going forward unless we believed that we could garner the votes by having a responsible bill to bring to our colleagues.
But you really don't.
Is it responsible to make this effective immediately for the next school year, or should there be a phase-in?
Yeah, you touched on one of the subjects which I'm sure will be a subject of conversation among the committee members, which is the implementation of the program. We as chairs, and I won't speak for Senator Abrams too much other than to say we accept it and appreciate all input, and every aspect of the bill, probably with the exception of removing the non-medical exemption, is open for conversation. That's the way we do things in our committee, because we're interested in the public health. And I do want to recognize Senator Anwar and Representative Kong. Would you like to say anything? Sure, please.
Thank you so much. I just want to mention that not a lot of clinicians out there have had an opportunity to see patients with the illnesses that we are talking about. I volunteer in various different third world countries and actually am able to see, I've seen polio, mumps, measles, rubella, many of these illnesses that we are talking about. And I would not wish them upon anyone in the world if I have my way. These are associated with, if not death in many cases, associated with multiple long-term impact encephalitis-related issues that is going to change the lives of people. And had there not been vaccines based on 11-year-old data, there would be 40,000 children who would die every 4 years. There would be $70 billion more expense in the healthcare that we don't even actually account for. There would be 20 million more illnesses. So this is what is at stake, and those numbers are much more at this time. So it's very easy to be able to, and look from a political point of view, when there's a lot of pressure, the easy part is to give up the responsibility on the pressure. But if we were here for like 1 year deal, 2 year deal, and we wanted to make people happy, that would be easy. Let's not make any changes and then make everybody happy and then look like heroes. But the reality is that the policies that we're looking at are going to be long-term impact to save the lives of children. And this is proven time and again. There's 100 years of experience around this. 100 years of experience, which would not counter some of the conversation, the depth of the conversation that we have been having on various areas. So again, I'm hopeful we will have good conversation. I know it's an emotional issue for a lot of people, but think about the fact that our healthcare system is not ready and will never be ready if we move in the wrong direction. And that's going to be at stake. And there are real lives of children that are at stake with respect to death, proven from data not only in the US, but the entire world. Thank you.
Dr. Anwar, before you go, I know you're intimately familiar with this proposal. Does it exempt pertussis? And if it does, why?
Does it exempt
certain children? Pertussis is included.
Yes.
It is, across the board.
Yes.
And for Representative Steinberger, Senator Abrams, a process question. You have this public hearing today, you mull it over, and when does the committee vote? Jonathan, you told me the 28th or the 30th. When is your JF deadline?
Well, that's the deadline for the whole committee.
Yeah.
So it could be any time between now and the end of March.
Exactly, but I think to your question previously as well, we have known all along the anxiety and around this issue for people. But I agree with Senator Anwar and Representative Steinberg. We're elected to lead. We don't want to see where that tipping point is, where there's a point of no return. We are elected to look at information and look ahead and make what we think is in the best judgment for our constituents, for the people of Connecticut.
And I think that's what we're doing with this bill. And I know that all of our colleagues will look at it in the same way, regardless of whether or not we agree in the end. I will say that that's why, too, that we put in this bill immediately and wanted to act on it right away. And we also wanted to let people know that it was our intention that it go into effect, should it pass, as quickly as possible. So all of those things are up for consideration and will be considered as we move through the process with the bill. But I think our intention needed to be clear so that as people came to talk to us about it, they would know what we wanted.
But you're surely not going to wait till the JF day.
No, I'm sorry. And I should answer that more directly. That's the point. So we would like to move on this as quickly as we can because we want to settle the issue for people. We don't want to leave people in limbo about it. And no matter how this ends up turning out, because as my colleague said, this is a process, we still want a resolution as quickly as we possibly can.
And have the House and Senate leaders agreed to bring it up quickly after you presumably approve it in committee?
I think the House and Senate leaders are willing to work with us in what we think is best in terms of moving this bill forward, and that would include moving as quickly.
Too, which is another controversial hot potato up here.
We'll do it at the same time.
But I mean, we do a lot of things, as you know, simultaneously in this building. So doing one does not preclude us doing the other.
Representative Pond, did you want to say?
I just wanted to address a question posed by Christine Stewart. I'm not on the Public Health Committee, and I do not speak for that membership except to say how seriously and deeply they have thought and listened and researched. To your question about phasing in, some of us in the House are talking about grandfathering clause so that those who are currently enrolled in schools but who are not, have not had the child immunizations would be allowed to stay, but then new enrollees going henceforth would be required. It's just a proposal, it's just one aspect of this, it's by no means written into the language, it's just an idea being kicked around that I think needs to be mentioned because of the question that was asked.
Do you have a champion for that concept on this committee who might introduce it?
No, it's just a thing that we're all discussing as colleagues.
We had one latecomer, and I'd like to have a chance to talk because she has a very personal start. Can you say it really quick? It's Juanita Costello.
Good morning. My name is Juanita Costello. I'm here on behalf of the Connecticut Chapter, National Association of Hispanic Nurses. But I'm also here as a mom and also as a cancer patient in favor of repealing the non-exception, religious exception in the state of Connecticut. This is hit home to me. It's personal. I know the importance of having vaccinations for children, but it's also important to protect those who are immunocompromised and are going through chemotherapy. So I'm here representing those cancer patients that cannot be here, who do not have the strength or the ability to be here, but to be their voice today. Thank you.
Thank you.
All right, thank you very much.
Thank you.
Thank you.